Thank you for, once again, for interrupting what must be interesting conversations given the level of buzz in the room. And we certainly want you to continue enjoying your lunch and dessert, but we are going to keep moving because we still have some wonderful speakers and guests here to continue our conversations. And I would like to have you meet and listen to Ruby Takanishi. Ruby is the retired president of the Foundation for Child Development in New York. We are extremely fond of Ruby and her work, and for those of you who have joined us in the past, she presented a couple of years ago at one of our Kids Count annual symposiums, and we are very, very pleased, Ruby, to have you back again. Ruby has spent her career advocating for how research on children's development can inform public policy and programs. She has a long list of accomplishments and has served on numerous boards and has been the recipient of many distinguished awards. Her list of accomplishments is impressive and extensive, but you don't get to hear any of it. Ruby is also very modest. But the most important thing that I have to say about Ruby is her humility and commitment to her work. When asked about a bio to introduce her, she said, "Just say I am the former president of the Foundation for Child Development." Well, clearly we could say a whole lot more, but we also want to respect Ruby's wishes. So I just want to say that her commitment, her national commitment to working on policy and advocacy issues and struggling with those of us out in the field and across the country and how to think about next steps and what the fundamentals are. We are very thrilled to have her with us. And she is always a dedicated and passionate advocate for young children and their families. So Ruby, welcome back.
Thank you very much. I really have to start off with an apology. I thought I sent my PowerPoints on Monday before I left home in New York, and apparently I didn't do it. So I will do that when I get back, because I'm really operating from a different system here and haven't figured it out. And so I have promised the people at Voices that you will have the PowerPoints and be able to take a look at them. So I really apologize for that. So I will be speaking from my reconstructed notes here, and so you can check to see how accurate my prepared remarks were in relationship to what I say today. So first of all, I would like to congratulate Voices for Illinois Children with the really excellent, concise, focused policy framework that you all have in your packets. I read them several times before I came because Joan Vitale was very good at sending that to Lisa and me a week ago, and it's just really exciting to see this agenda so well developed and put together. Today, what I want to do in my 30 minutes or so is to do two things. One, I'd like to share a few thoughts about the policy framework. And then secondly, I want to talk about how you move from having this terrific framework into a policy agenda and social strategy for achieving the goals that you have articulated in your policy framework. So first of all, a couple of comments about the Grade at 8 policy framework. First of all, I realize that Voices for Illinois Children is the premier child advocacy organization in the country. I can say 30 years ago or so, when I started doing some work certainly in the foundation sector, I knew about Voices and Voices work for children. So you have an extremely distinguished history as a child advocacy organization. When I first went to the Foundation for Child Development in 1997, which seems like eons ago, one of the first things I did was to fund a new center on nonprofits and philanthropy at the Urban Institute in Washington, D.C. That center still continues and has flourished. But one of the first things they did was to do a study of child advocacy, particularly child advocacy organizations in the United States. And it resulted in the publication of a book, which I think is still very relevant. It's called Who Speaks for America's Children? And I did that because I was very interested in the state of child advocacy. Remember, this is about, close to 20 years ago, right? I was very interested in the state of child advocacy and how we could be more effective in our child advocacy organizations. That was the purpose. So as part of the introduction to the Urban Institute's collection of work, and by the way, it also had a very good chapter on the role of philanthropy in this. Emmett Carson, who was then the president of the Minneapolis Community Foundation and now president of the Silicon Valley Community Foundation in California, who has a background as a political scientist, was asked to do the introduction. And as a political scientist and as a very, sympathetic observer and so forth, Emmett started off with a paragraph which really has resonated with me all of these years. He said something like, really one of the challenges of child advocacy organizations is they have so many issues that they're trying to pursue. And that it really is so daunting because what we have found out then and up till now, that it's very important to have focus, to really be able to set priorities and to, say that you stand for something and to work on it. And so, I will go back to this when I talk about how do you move your policy framework into a policy agenda and a social strategy. But it's really a sort of a preliminary to saying that I believe that now, certainly about 16 years after we funded that study, is that it's really important for child advocacy organizations to link up and connect very strongly with organizations and advocacy organizations that are dealing with what I would call larger issues. I say that because much has been made about the demography of our election that just occurred and how and why certain things happen. At the Foundation for Child Development, as you may know, we developed the Child Wellbeing Index and this year started to issue publicly state child well-being indices as well. But the demography of children and families in the United States is that children and families are a minority. Less than 50%, less than 40%, I think, of American households now have a child under the age of 18. So, you know, I think it's really important to look at how child and family advocacy really sits in kind of the demography, the kind of demographic analyses that have been made in the last 24 hours of our recent national elections. To me, one of the things that it says is that child advocacy organizations must partner, must align with other advocacy organizations that could really have an impact on the very issues that are outlined in your policy framework. So let me just tell you two issues where I think this alignment between child advocacy organizations such as Illinois, Voices for Illinois Children, could work. One is in family economic security. Family economic security is something that you identify as goal one, and I would say that you say families are secure. I would say families are economically secure and positively engaged in their children's lives and be able to foster their children's full development and potential. It's definitely in there. I would just like to emphasize that I think the two big issues, certainly immediately before us, are jobs and education reform. So on the jobs issue, what I'm trying to say is that it is really, really important for every goal that you have in your Great by 8 policy framework that families be economically secure. And as we know from reports that were issued this year on the declining fortunes of middle-class families and so forth, we know it's very, very clear that families in the United States, particularly middle-class families, have suffered major, major blows to their economic resources. And this has an impact on all of your goals. Supportive communities are related to family economic resources. Health insurance coverage is related to employment, and thank goodness because of the state child health insurance program, the SHIP programs and so forth, the recession and the economic decline has maybe had less of an impact on health, children's health access, but we still have a health insurance system that is very much linked to employment and quality employment. Access to early childhood care and education is really based on families' economic resources to pay. So I was looking at the report about what families and parents in Illinois say about what they need, and it's very clear in there that what families are saying is most of us who are not in certain categories of need or disadvantage, we have no access to or assistance with child care and early education. And of course, for many of us who are affluent, we'll just pay for it. But the vast majority of American families don't have access to quality care and education because they have to pay for it and they have no resources to do so. And then finally, effective teaching and learning, we do know that, again, the quality of education is related to families' income and community resources in the United States. So I think it's really, really important to move toward what we started to do when I left the foundation, which is called dual generation strategies. I think we really need to think about coupling child development and adult economic development. That is to link quality early learning programs with quality workforce development programs. And I'm very pleased that there are these efforts going on in the U.S. right now. So to move from family economic security and how important it is, I'd just like to, my second comment has to do with education. I've been talking a lot in recent months about the transformation of the American public education system. And I've been doing that because I'm asked a lot to talk about early learning and how important it is and so forth. And it definitely is, and everybody in this room would agree about this. But what I've been trying to put forward as a framework is that we need a basic transformation of the American public education system, which is now a K-12 education system, with K sort of being put in there, but really, as we know, has a very tenuous provision in our states. What I'm saying is that education has to be a birth-to-death system. We have to think about how we educate children from the very beginning and their parents and adults and so forth to the very end. Because most of us know, and my PowerPoint failures is one example of this, that if you're not able to learn and adapt to new technologies, you're going to really be in trouble. And so we really need to rethink, I think, we need to not only rethink, redesign, and transform our public education system. Early learning, pre-K to third, all of that is really, really important, but so is middle grades education, high school education, and everything that happens in adult and post-secondary education as well. So I'm very pleased that there are at least two examples that I know of from your state that I think are really going to have an impact on the rest of the country. The first that Lisa Guernsey also talked about quite a bit is what is known as the Chicago Child Parent Centers, which is really originally started public school-based, Title I funded, starting with early learning and a very close connection, at least to the third grade, and longitudinal studies indicating long-term effects. So you have that. And there's a really, really exciting effort that's now going on between the Ounce of Prevention and the Urban Education Institute, funded by the Kellogg Foundation, the McCormick Foundation, and the Foundation for Child Development, which has really funded the case studies and the teaching materials. But it's really an effort to create a birth to college public education system in the United States. And I do believe these two efforts right in your state, as well as others that Lisa Guernsey talked to you about, are really going to be very important in people's rethinking about when education begins, that it never ends, and the hard work that is required to connect early learning programs to our public education system. So we really need to think of early learning not as apart from, but part of public education system, and this has a lot of clear implications. So one of the things that is happening in several states, Oklahoma, West Virginia, Florida, and other places, is that programs, early learning programs, at least at the age of 4, are part of state general revenue, state education formula programs. And as we look at the last 10 to 15 years of experience with funding early learning programs, that is one strategy that I've been really advocating as being an important policy goal to try to achieve. The other thing that I would talk about is Title I. We need to move from 2% of Title I funds being used for early learning programs to anything better than that, because it's actually gone down. Title I as you know, is supposed to be an evidence-based program or funding stream to raise the level of achievement of low-income children in the United States. How does that fit? How does the 2% fit with what we know could be really helpful toward that goal? So I think that Title I is a very important source of funding for our state pre-K programs. The final thing that I want to say, because I can't say very much about it, but I believe that this is the period of time, birth to 8, is really a prime time for dual language learning. And it should be dual language learning for all children, not only children whose first language is not English. The other thing that I would really advocate for, and I'm seeing some of the states that are doing this, California, Minnesota, and I believe Colorado, now have a seal of biliteracy that is affixed to the high school graduation diplomas of students in their states. And I think this is long overdue. But it also has really important implications for how we deliver our early childhood program. So now I want to move toward from a policy framework, which you have right here, to a policy agenda. Julie Richmond, who is a native of Illinois and who was one of the first, he was the first director of Head Start and Surgeon General twice and so forth, talked about the importance of having a social strategy. And by this he meant, and you can look up his articles and so forth, he was saying a couple of things, which are very related, but certainly can be parsed out. Policies matter for sustainability. Anytime you have an idea that you think could really work, you have to think about how it's going to be put into place for policy, because that is the only way in which you're going to have sustainability over time. The other thing that Julie said, which I think was really important to me and so important right now, is that a social strategy should not only result in policies, whether it's state policies or district policies or a federal policy, but it should always aim to reach the largest number of children, in this particular case he was talking about. Now, we have a real conundrum that is facing us right now. As you know, there's a fiscal cliff, there's, state problems and budgets and so forth and so on. And I think that this is really the timing strategically is to say there are things that we want, and I would say certainly in the policy framework, that must be provided for all children and families, not for just some. It's, I guess, what some people would call a targeted versus universal approach, which is very controversial in the child advocacy field, and I'm sure it's controversial here as well. But the fact of the matter is, if you look demographically at where American families are economically, you will see that a vast majority of American families are really not able to provide these kinds of resources to their children without assistance. It's not just some children, it's a very large number of children. And so, as I mentioned, in early learning programs, you have a situation where if you are in poverty, or let's say Head Start, 50% of the eligible children can have that program, and the 50% who are eligible can't. I don't know what the child care subsidy coverage is, but it's probably between 12% of eligibles now have services. So you can see that, and of course affluent parents can always provide for their children, but there is a vast majority of American families who are not able to provide quality early education, to have their kids go to effective teaching and learning through the 3rd grade, to provide them with the health care they need, to live in supportive communities, and so forth. So I think we really need to think of a strategy that really is much more inclusive of families than in the past, and I do believe it will be a win-win situation. So it's really important to be able to move from the excellent grade by 8 policy framework that you have to a policy agenda. And by definition, a policy agenda means that you have to make choices, you have to compromise, you have to be focused, and you have to be disciplined, and you're not going to get everything. I mean, that's just basically our political process. And so I think that the hard work before all of us is how do we move from an excellent grade by 8 policy framework to a policy agenda and to a social strategy that will make it possible to achieve these goals. In closing, I just want to say that it's really important to take a long-term view about this. Going back to Julie Richmond again, it took about 40 years. I mean, we have made enormous progress in a number of areas in my lifetime. Tobacco prevention or smoking cessation or whatever you want to call it. It took about 40 years to come to the place that we are now. And that's been very well documented. And Julie Richmond was one of the people who started it and was able to see the progress, thank goodness, in his lifetime. Women's suffrage, documented very well by Ken Burns, 40 years. The Voting Rights Amendment, 100 years. The kindergarten movement, finally, at least 40 years to get kindergarten as part of the K-12 public education system, but as you know, 40% of children are still not in full-day kindergarten, and as we speak, kindergarten ages are being raised when we know that children have much greater capacity to learn than they had when the kindergarten movement started. So these are very long-term kinds of marches, as I call it. And progress is not linear. So even when you see, tobacco prevention, there's still backward steps, kindergarten backward steps, and certainly with voting, backward steps, right? But in general, we have made enormous progress in the United States, and I'm very pleased to hear that. So in closing, I'm going to use the exact quote that I used in the Kids Count. I went back, of course, to look at my PowerPoints from that March 2011 presentation because I didn't want to repeat myself. But really, and I just had seen last week in Minneapolis Appomattox, which was a play at the Guthrie Theater. And there's a wonderful speech there by Martin Luther King, who said that, how long? Not long. This was on Montgomery in March of 1965. The arc of the moral universe is long, but it bends toward justice. So I hope that you will take this wonderful policy framework that you have and put it into an agenda, combine it with a social strategy, and be really effective in this state, because as we well know, the majority of American children and families are not doing very well, and this is not good for our communities, and it's not good for our nation. So thank you very much.